Okay, yeah,
Yes.
it has been started. Okay,
Yes. Now you can come to the full screen.
all right.
Yeah. Now, please.
So
Thank
yeah,
you.
it was my introduction, and then it is a definition. What is varicose veins are? Varicose veins are dilated, tortuous, subcutaneous, often palpable. Like it is not like compulsory that it should be palpable or not, but it is often palpable, and they are more than 3 millimeter in diameter. Okay, these are dilated, tortuous, subcutaneous, and often palpable. Okay, like look, so if I show it here, you can see that these are visible, these are tortuous means they are not in a line, they are not a straight, they are like bulking, like snake, like a margonde the say tausivi kana. These are called tortuous. So and when it comes to the like microscopic levels, they are more than 3 millimeter in diameter. Okay. So etiology mean causes. So like they are varicose veins are always in a two. We put it in a two category. Okay, first is primary varicose vein, and then is secondary varicose vein. Okay, uh, let me know if I am talking so like rapidly. So let me know. Okay, because this is my habit. So I don't know. We are all friends. Okay, so you can talk to me very friendly. So yeah, primary varicose veins, 95% varicose veins are caused by increase in venous pressure in the superficial veins of the leg due to the damage of the venous valves. What does it mean? It means that in 95% cases, the varicose veins are due to the damage of the venous walls. In veins that are present in lower limb, in our legs, they have walls. Why? Because the blood from the veins they need to go up in upward direction. If there would be no wall, the blood would be in a same like in a downward direction because of the gravity. So the walls are important in the lower limb. You have studied it in your second year, first year, like to put the blood in the exact position. Like do not let the blood to come down. Okay. So whenever such problems occur to those walls, and they don't perform their function, so blood don't go upward direction in up like in upward direction, so it remains in the downward direction. It accumulates and then it form a pool. Pool mean like swimming pool. It like accumulates and it becomes greater in size, and then it like becomes the varicose vein. So here like they have told us a few various sites where this even occur. Most probably it occurs in the sphenofemoral junction. You know that sphenofemoral junction at the femoral point, in our groin area, below the inguinal ligament. The inguinal ligament secum the manga area da kana ede landi sphenofemoral junction. No agal tasefnas او femoral vein شدي كنا غيوبل سرا communicate كيجي كنا نو دغل تا زياد دسه دغه د varicose vein جوړېدل چانسونه زیات دي. Duang, the second place where the sphenopopliteal junction, sphenopopliteal चकम level the health the event chada yani the varicose vein zyat jodegi. And the third one is incompetent perforators between superficial and deep veins. Okay, tell me what is the perforators. So the perforators, we have two type veins, superficial veins and deep veins. And the perforator veins are the ones who communicate these two veins. The superficial or deep vein ones ke chakam veins di agata manga perforator veins vayu. Kode ke kam problem paidashi if any problems happens in this perforator. So chances of becoming and giving rise to the varicose vein is like so common. So yeah, This is a picture. I have tried like to make you understand with the different pictures I got like from the different sources. So yeah, the big one, you know, the wider one is a deep vein. If my arrow is visible, this one is a deep vein, and this one is superficial vein, and this one is perforator veins. I was telling you, okay, if there is a problem in this, then still varicose vein formation occur if there is a sphenofemoral junction or sphenopopliteal junction. Got it? I don't know why it's not moving around. Okay. And then it comes to the secondary varicose vein. When these occur when the pressure is increased in the superficial venous system, basically superficial veins, due to the obstruction of the blood flow. Okay, first we have told that increased venous pressure because of the difficulty in the walls. Okay, and primarily varicose vein when there is a problem occur in the walls. Okay, chakala kala wall ke problem mi no biaba primary varicose vein or the obstruction of the blood flow of hindrance rasi obstructions rasi mushkil rasi via secondary varicose vein jodegi no the examples chishedi misalune chishedi for example deep venous thrombosis lakache the deep veins ki kalaga jodegi clot formation kigi venous malformation embryologically taso badadars vaili chekala arteries of veins jodegi the wood formation ke like embryo formation agawah ke chekala problem paida si obesity वजह केदले से मतलब इंसान वजन ज्यादा की कना नो वजन ज्यादा दल वसर संग दसे केदले से वजन च इंसान ज्यादा से डेफिनेटली एडिपोसाइट्स ज्यादा की फैट्स ज्यादा की नोगा प्रेशर अच्छे पे वेन्स बंदे च वेन बंदे प्रेशर रसी अगर मत इंट्रावेनस प्रेशर चदा कना अगर ज्यादा की जगह ज्यादा से बिया वेरिकोज वेन फॉर्मेशन चदा अगर जोड़ेगी mass in the abdomen and pelvis. Abdomen pelvis area के mass for example से रकम mass यानी ट्यूमर सी या बल दसे mass पैदाशी करना च अगा पोगा बंदे veins बंदे pressure वाचे अगा under pressurized की और contraceptives خلق هغه ښځې چې contraceptives استعمالوي نو هغو کې د varicose vein formation څه ده هغه زیات کیږي دې میکانیزم چې شی ده like contraceptives څنګه varicose vein جوړوي like how it can make lead to the formation of the varicose vein whenever a female who like used to get the oral contraceptives there is a formation of the clot formation کیږي اگر نه بعد clot سی definitely clot مطلب دا د وین په لارې کې یو clot جوړ سی یو نور غ blood flow چې دا غ صحیح نه کیږي نو غلوا چې دا blood وین کې accumulate کیږي او pool formation کیږي pool بیا زه درته وایم like swimming pool جوړیږي کنه for example هغه ته accumulate کیږي یو ځای کیږي او هغه وین چې دا هغه بیا غسي dilate سي غټ سي او بل وجه چې دا د occupations یعنی different هغه روزګار مختلف روزګار د سدي چې varicose vein جوړي for example the person who like lifting heavy weights هغه کسان چې کوم gymnasium ته ځي extreme level باندې اسه خو exercise ډیر ښه زیات عادت ده لیکن extreme level باندې lifting heavy weights کوي یا کم خلک چې دا trucks کې کار کوي زیات سامان هغه کوي جګي هغه کوي مطلب وزن جګي په هو کې زیاتی and then long standing مطلب خصوصا د ډاکټرانو کې چې هغه ډاکټران چې 15 یا 14 ساعت سرجري کوي کنه نو یو ځای کې غوډ ولاړی وجه چې ده د varicose vein formation کیږي. lack of exercise زیاتره دغه هغه ښځو کې دي چې هغه کور کې ناستې او میندو کې چې غټ زیات عمر زیات سي 15 40 کاله نه پس هغه کور کې یو ځای کینی ډیفینیټلی ایکسرسایزز نه کوي نو زیات یو ځای کې ناستېدلو له وجې varicose vein کېدلی شي. No, this is the another picture that I have, like opted for you people. This one is a normal, normal vein. Look, the blood flow is in the upper side. This is the valve. How this valve gets open when it comes in contact with the blood. And this one is the normal vein. When it comes to the tortuous veins, varicose vein, look, this is called pooling. This is called dilation. Look, the direction of the blood. Normally here the blood like goes in upward direction. Here it comes in upward plus in downward direction. Skin is bulging and the wall of the veins, it becomes thin. نریکیږي دا د وینز وال چې دی دا هم کمزور شي هغه وینز هم چې دا هم ډایلیټ شي او د بلډ فلو ډایرکشن چې دا هغه هم ابنورمال شي. So here comes the classification. There are different types of the classification. First we come towards the clinical classification. Okay, the clinical classification is the C0, C1, 2, 3, 4, 5, 6. Okay, C0 mean zero matlab no visible or palpable sign of the venous disease. मतलब अगर इंसान के venous disease लेकिन अगर कम sign न वर्कई symptoms न वर्कई चकला दगा महीना वसी द महीने पर लिहाज बंदे अल्तसख कारी ना. Okay, and C1 is the reticular. Okay, reticular داغه وین دی dilated دی لیکن دو diameter چې دا 1 یو نه تر 3 پورې پوښوي منګه normally شاته وې کنه. I have just studied that varicose veins diameter is more than 3 millimeter, but reticular veins are also varicose veins, but their diameter is around 1 to 3, like not more than 3. Okay, threaded मतलब तार गुंदे वेंजी मतलब नरई कारी लेकिन नरई यदि तो diameter चदा less than 1 millimeter. The C2 के varicose veins मंगा वर्ता वेलाई सु अगर के diameter more than 3 millimeter राजी. C3 के आगा level रासी की चे edema accumulation of the fluid होता. सो थर्ड ईयर पैथोलॉजी की वेली चे इन्फ्लेमेशन की इन्फ्लेमेशन ना बाचे दा एक्स्ट्रा सेलुलर स्पेसेस के फ्लूइड राजी डेफिनेटली फ्लूइड खबर राजी veins के चे दा blood normal नजियास अगर dilates reactions ए वक space ज्यादा वाकिस्त no edema that whole pathological reaction چې وسه دغه په نتیجه کې اډیما کیږي. C4 لیول کې skin changes کیږي pigmentations کیږي मतलब کب خو ته وګورئ دغه رنگ چینج کیږي نورمال کا او د افیکټډ فیټ یو بل سره کمپیر کوي نو دغه افیکټډ فیټ کې pigmentation سوي eczema سوي dryness سوي پښوی دا هم د dermatological manifestation د دغه C4 skin changes کې راځي کنه. نو C5 کې چې دا هغه کې هم pigmentation هم وي eczema می ورسره healed ulceration کې پوښي نو ulceration څه ته وایي هغه هم pathological phenomenon دا چې تاسو third year کې به ویلي چې ulceration کېږي لیکن هغه ulceration मतलब تکمیله سوی هغه healed سوی. نو C6 کې skin changes راځي چې هغه کې هم بیا دا ټول شیانی pigmentation می eczema لیکن هغه سره active ulceration active ulceration मतलब دا دی چې ulceration اوس هم روان ده. It means that a person is also having a pigmentation and eczema, but additionally the ulceration is active. It doesn't heal. I mean, he is very prone to the infection. That's a very serious situation. When we got kind of trauma to our body, for example, like we have a cut in our hand, like it's get healed with the time. First it just like get like all the ulceration process continues. Like first it gets like approximation of the wound edges, and then it becomes fibrosed and then become ulcer, if you remember the normal phenomenon of the trauma, when trauma occurred to her body. So in this, ulceration is continued, it doesn't get healed, so it's like a kind of bit serious situation. And then etiological classification. Okay, and first was clinical, this is etiological. In this we have said it's a congenital, like any problem, venous problem that occurs by birth. Okay, and then it's primary, that we have studied like a few times back. And then secondary, and when there's no venous cause identified. Okay, so it's just nothing to get understand, you need to like remember all these things. And then it comes to the anatomical classification. We have like four things in it. We have a superficial veins, and then perforated veins, and then deep veins, and no venous location identified. And then pathophysiological classification. There is a reflex. I have already made you understand about the reflex, when there is normally the blood flow occurs in upward direction. When it comes back to the downward direction, it's like reflux. And then it comes to the obstructive. Sometimes it's a reflex plus obstructive. And then it comes to the no venous pathophysiology identified. Okay. Okay, then it comes to the symptoms. Okay, like how would it feel if you are like if a patient is suffering from varicose vein. First it's aching, like a person would come in a hospital, and he says that, Dr. Saab, I'm feeling pain in my leg, I'm feeling like heaviness, there is something like a burden in my legs. Whenever I lay down, and sometimes when I put my legs in upward direction, it's just get okay. So that would be the problem, he would say. And unsightly appearance, what does mean by that? Like if you will compare the both two legs, the patients دوه ډبکې یو بل سره compare وکړي. کلینیکل همیشه دغه اصول لري چې کله هم درته مریض راځي باید کغه لاس پرابلم لري، که د هر ځای لاس پرابلم لري، هر شی چې all everything that is a pair always compare. مطلب هر شی چې په جوړه کې لکه پښې، لکه لاسونه، لکه سترګې، سږمې دوه nostrils، تاسو به د یو nostrils د بل nostril سره، یا یو غوږ د بل غوږ سره، یا یو سترګه د بل سترګې سره کمپیر کوئ. نو unsightly appearance دا ده چې هغه پښه به چې درته وایي چې د ما دغه پښې کې پرابلم ده، درد کېږي او ډېر داسې درندره دنده ماته معلومیږي، نو تاسو هغه پښه به دغه بلې نورمال پښې سره کمپیر کوئ. صحیح ده؟ نو تاسو ته به معلوم سي چې هغه پړسېدلې، هغه کې به وینس ښکاره کېږي او هغه به داسې سایز کې نورمل نه زیات غټ وي. throbbing and itching، هغه به وایي زما په پښې کې خارښ ده. throbbing خو پوهېږې که نه چې شته وایي لایک هغه د پین یو ټایپ ده، داسې څړیکه کېږي، هغه به ما درته وایي ډاکټر صاحب زما په پښې کې څړیکه کېږي. بیا به ته ګورې swelling of the leg ده، دغه څه کوم پښه ده هغه به پړسېدلی، او د ankle څه ده پونده، سوري د ما پښتو صحیح نه دی، پونده ورته مطلب ankle، هغه هم پړسېدلی. نو هغلته به چې تاسو وګورئ هغه هم به پړسېدلی. او reticular and threaded veins به یې څه پاسه یې وګورئ superficially، نو threaded veins به داسې تار غوندې نري veins به ښکاري، یا reticular veins به ښکاري، او atrophic blanche به یې. اوکې، نو atrophic blanche چې ده هغه څه ته وایي، نو هغه به زه دلته هغه کړم یو atrophic blanche چې ده دلته ما atrophic blanches چې ده basically هغه white atrophic skin that is surrounded by the dilated capillaries and hyperpigmentation seen around the ankle. Okay, نو دا به زه اوس درته پکچر کې ښکاره کړم لایک وایټ اټرافیک سکین دا سکین چې دا کنه د منګه کم جل دغه سپین کېږي اټرافیک سوی او دغه په سراوندډ کې ډایلیټډ کیپلریز او رنگ هم بدل سوی او دا موست پروببلی چې دا په هغه کې انکل سایډ کې نو دلته پکچر کې درته ښکاره کوم نو زیات خبر راشي I think this one. Got it? ما ورته ویلې چې like it's a pigmentation ته وګوره دا نورمال ځای ده او دا ګوره سور سوی ده دې ته وایي pigmentation مونږ وایي چې whitish area ده که نه ګوره whitish area ده او دې surrounded چې ده dilated veins دي ګوره dilated veins دي او مونږ ویلې ankle side دي دې ځای کې دي رنګ هم بدل شوی ده white اټرافیک ایریا ده او دې سراوندډ کې دغه څه ده غور وکړئ نو ډایلیټډ وینز پراته دي دې ته وایي اټرافیک پلانشیټ چې دا موږ شاته دلته وویلې just a minute and then complications complications there are some varicose vein what kind of complication is caused by the varicose vein bleeding kedalai shi superficial thrombophlebitis kedalai shi eczema kedalai shi eczema amaga خارخ کېدلی سي سکین پرابلمز ډرماټایټس کېدلی سي پګمنټیشن کېدلی سي مطلب د پښې کلر چې دا د پښې رنګ بدلیدلی سي بعض کسانو چې دي کاسمیټیکلی چې دي هغه ډېر conscious like they're very conscious cosmetically هغه وایي زمونږ پښې بدرنګې سوي نو هغه لپاره پګمنټیشن کېدلی سي السریشن کېدلی سي زخم جوړېدلی سي او دغه پرابلم کېدلی شي پوه شوې نو ډایګنوزس کې به موږ هیسټري اول اخلو ټوله هیسټري به اخلو هیسټري تاسو خو به هاسپټلز کې اخیستلي که نه ډیموګرافیک ډیټیلز او پریویس هیسټري پریویس میډیکل سرجیکل هیسټري پریزنټینګ کمپلین هیسټري اف د پریزنټینګ کمپلینز هر شی به ورنه تپوس کوئ بیا به ایگزامینیشنز کوئ نو ایگزامینیشنز چې ده هغه دې لپاره چې کوم ټورنیکیټ دوه ایگزامینیشن کې آی تھنک ټرینډربرګ یا اټس ا ټرینډربرګ یو ایگزامینیشن ده یو بل ایگزامینیشن ده هغه دواړه کېږي چې دا معلوم کې آیا د ته وریکوز وین ده یا کوم بل پرابلم ده هغه نه بعد چې ده ډوپلیکس الټراساوند امیجینګ کېږي نو ډوپلیکس الټراساوند امیجینګ څه کېږي چې duplex ultrasound imaging کې څه ده we look for the two things okay دا obviously it's a type of ultrasound دا یو ultrasound ده لیکن دې کې موږ دوه شیان ګورو موږ vascular anatomy ګورو موږ the direction of the blood flow ګورو صحیح ده نو دا دواړه شیانو په طریقې باندې موږ ایمیج حاصل کوو هغه ایمیج یعنی موږ چې دغه دواړه شیان چې په نظر کې کېدو او ایمیج واخلو بیا موږ ګورو چې اکچوال پرابلم په چیش کې ده په والز کې ده په پرفوریټر وینز کې ده که ډیپ وینز کې ده ډیپ وین ترومبوسس ده یا سپرفیشل وینز کې کوم پرابلمز ده نو دغه شیان په دا ټول شیان په دې ډوپلیکس الټراساوند امیجینګ کې کېږي او بیا آخري پوینټ چې دغه وینوګرافي ده ګرافي مطلب همدا ده چې د کم هم باډي حصه پکچر اخیستل پوه شوې وین مطلب د وینز ګرافي مطلب د وین پکچر اخیستل په دې کې موږ څه شی کوو چې انجکشن اخلو په انجکشن کې کانټراسټ دی پوه شوې هغه کانټراسټ چې دا په سپرفیشل وینز کې انجکټ کوو چې کله موږ انجکټ کو بیا هغه وینز چې دا فار ایگزامپل که تاسو جی آی ټي ویلی که نه ګیسټو انټسټاینل ټریک نو هغه کې موږ بیریم انیم استعمالو بیریم فالو کوو لایک بیریم هغه ته وایي چې دا واخلئ هغه نه بعد چې دا دغه جی آی ټي چې دا لایک کولمې چې دی سټمک دا انټسټاین دا لارج کولون سمال کولون دا ټول ویزیبل شي همدغه څه حساب وینوګرافي کم کېږي چې کانټراسټ انجکټ کوي هغه نه بعد هغه وینز چې دا پرومیننټ سي بیا دغه ایکس رې اخلي بیا ایکس رې چې واخلي بیا سړی په دې ډاکټر چې دا هغه دې باندې ځان پوهي چې پرابلم اکچولي چیرته ده and then it comes toward the management. Management में asymptomatic की मतलब कम प्रॉब्लम न लड़ेगा, एज तुम ना सिर्फ तकलीफ मामूली तकलीफ लरी लेकिन तुम नजियत विजिबल प्रॉब्लम न लरी बेगा तमंग वही च लाइफस्टाइल मॉडिफिकेशंस वका यानी खपल पजवन के चेंजिंग्स रावड़ा वजन कम का एक्सरसाइज वका हाई फाइबरी डाइट वाखला او वेट लिफ्टिंग का कम दसे कार कई यानी हैवी कार कई और तो यगा अगना اجتناب وكاغا avoid का نو أغنى علاوات سدا أجر أغا symptomatic دا मतलब علامات لري symptoms لري نو بیا أغنى بعد graduated compression stocking को graduated compression stocking کې څه کېږي ما سره دا picture شته دا دې کې داسې یو جرابې غوندې سټاکس بیسیکلی جرابو ته وایي نو دغه استعمال کېږي for a medicated person for a medicated reason په دې کې څه کېږي چې what has happened in this that it like put pressure on the veins نو هغه وینز چې کوم ډایلیټډ دي د هغه چې دا مزید ډایلیټیشنز نه درې مزید هغه کوي مطلب نه هغه کوي مطلب ډایلیټیشن سره نه پریدي دا ډیپ ونس ترومبوسس کې دوم زیات هغه نه ده فایدهمند نه ده لیکن سم هاو سپرفیشل اگر مسله په سپرفیشل وینز کې نو هغه مسله مزید زیاتول درولو لپاره موږ دا استعمالو graduated compression stocking او دوام چې دا هغه کې دا انډووینس تھراپي کې څه کېږي چې د کې موږ وایو الټراساوند ګایډز فوم تھراپي الټراساوند ګایډز فوم تھراپي کوو انډووینس لیزر ابلیشنز کوو او بیا ورسره ریډیو فریکوئنسي ابلیشن کوو نو الټراساوند ګایډز فوم تھراپي کې موږ چې دا الټراساوند استعمالو الټراساوند په سره طریقې سره موږ چې دا د کې دا کم وینز چې دي دا کم ډایلیټډ وینز دي د کې موږ دغه تھراپي استعمالو چې موږ دا چې کم ډایلیټډ وینز دي د چې کم شیپ دا هغه نورمال لغه تراوړو لایک ډایلیټډ او ټورشز دي کنه نو هغه سیده کې ډایرکشنز کې راولو د ته وی الټراساوند ګایډز فوم تھراپي او غنا بعد انډووینس لیزر ابلیشنز کو په انډووینس لیزر ابلیشنز کې سکیږي په هغه کې هم د سیدا لیک الټراساوند فوم تھراپي کوونده دا لیکن د کې مونږ چې دا لیزر کو انټروډوس کو فور ایگزامپل دلته شته د سه دا غدا varicose veins په دې کې دا سه لیزر فایبر انسرټ کړي لیزر فایبر چې کله انسرټس هغه نه بعد لیزر بیم هغه کوي لیزر بیم ټرند آن کوي هغه آن کوي هغه نه بعد کته سودا او دا کمپیر کوي دا څه دا ټورشیس ده او دا چې دا blood flow normally indirectly کومه وایو if we can say that it just like makes the shape of veins in a like a straight direction. Okay, so the another was is a radio frequency هم همدغه د لیزر غوندې ده بالکل سیم ایگزیکټلی هم د استعمالیږي او د کې بس همدغه هغه کېږي ټیکنیک استعمال کېږي لیکن دا څه ده د ډېر زیات پاپولر نه ده په ایشین کنټریز کې او بیا راغله سرجري آخری option the surgery کدو سره کرنا سو بیا we will go towards the surgical procedure and then surgery ba like at what condition we need to do the surgery sorry I just forgot we need to do the surgery when there is a hemorrhages like you know when there is a bleeding when there is a skin changes when there is an incompetent perforator when there is a symptom like a doctor sahib desert stare kega ma doctor sahib the majon mushkila sawai the jab khe da mare drandi se with the normal work na kawle some doctor sahib the mab khete پړسېدلې دي د ما ژوند دې سره مشکله سوی ده کاسمیټیک ریزن یو پیشنټ رسېده ته ډاکټر صاحب د ما پښه یوه پښه سپینه ده یوه سره ده زه نه غواړم چې داسې بدرنګه ښکاره سي ډیپ وین ترومبوسس چې کله ډیپ وین کې چې دا ترومبوسس وي نو هلته مسله نو انکمپیټنټ پرفوریټرز مطلب خو پوهېږي که چې هغه پرفوریټر وینز کې مسله نو دې صورتحال کې موږ باید سرجري وکړو او surgical options څه optionونه دي surgical options saphenofemoral junction ligation ورکولای سو ما تاسو ته ولم ویلي دي I have told you earlier that problem may reoccur in the primary varicose vein when there is a problem in the saphenofemoral junction saphenopopliteal junction and the perforators ligations when there is a saphenofemoral junction so we need to like give a ligation at that level so and then saphenopopliteal junction same I will show a video I have like arrange a video you will like go through the video it just like a 2 minutes and then all the concept get clear to you all and then it's perforator ligation I told you that when there is a problem in the perforators like the vein that connect the superficial vein and deep veins we need to like get that veins okay and then removing superficial veins then it's called the phlebectomy okay so I just like make you understand about the phlebectomy first and then I will show the video okay this is a phlebectomy in a phlebectomy this is called the vein superficial vein we need to give a cut through the skin and then we use a hook okay hook like a holder kind of thing and then we have inserted the hook and it is at the level of the veins and then we holded it here and try to cut it and then look it just like cut like that it's called phlebectomy so and yeah so this is a a short summary of the varicose veins I need to show the video but just like go through it I think I should like show the video first and then you will like I hope it's like visible to you all and wait is it visible please somebody please reply me is it visible
Yes, it's visible.
Yes, it's visible.
okay let me know if you don't get any point okay just listen to it and then it's just 2-minute video this is actually the surgical procedure I told you the saphenopopliteal saphenofemoral junction like how to ligate
The veins that most commonly these veins lie just below your skin and run from your feet to your thighs. Here we show the position of the superficial veins of the leg. The procedure is usually carried out under general anesthesia. This means you'll be asleep during the operation. Your surgeon
it means before like have to start the operation we need to give the general anesthesia not local anesthesia these all steps are very important like for a surgeon not at your level but of course these are important so that's why I had to stop and tell you
two small cuts, one near your groin and one near your ankle. Here we show the cuts being made. At the cut near your groin, the surgeon plans to stop the blood. Surgeon will then cut the vein
so
stitches
If you have noticed, they have, like first narrowed the vein, okay? Like first they narrow the vein and then they put a cut.
is known as luggage. A woman is then cast as Varicose vein form. The surgeon will find the varicose vein and clamp it with the surgeon will then cut the vein and stitch it at the top. This is known as luggage. A woman is then cast down through the one along with varicose vein is then pulled out through the cut. This is known as stretching. Your surgeon will close the cuts with stitches. Often, the other small veins in your surgeon will make small cuts along and other small veins. Here, we show the small cuts being made along and the veins being
Teacher, we don't hear the voice.
and you will need to
Okay, you got this video or not? First, what they have done, that they have like, put a cut on a two different level, okay? And groin level, okay, in a groin level, and then at the knee level, okay? Because they need to pass that wire, so for that they have like, give a cut, you can say incision on the like a groin level, and then on the down level, and then they have clamped, like they have pressed the veins, okay, and then they give a cut to the vein, okay, and then they pass that, I forgot what was it, was not a wire actually, but it was a, got a different name by medical terminology, and then they have passed that wire, okay. Now you got the point. Osta suppose say چې دوه مختلف کټونه ولې ولګېدل. اول کټ په دې خاطر ولګېدل چې هغه کې هغه وایر تیر سي، او هغه بل کټ په دې خاطر ولګاو چې هغه نه هغه وایر راوباسي. نو basically passing a wire, it was not a wire, I forgot the name actually, but the function of that wire is basically to make the tortuous vein in a, in a straight position, okay. So it was a surgical procedure. This was only for the staphenofemoral junction, okay. It was not for both, like stephenopopliteal. Popliteal, it comes like behind your knee, about the popliteal fossa. Popliteal fossa for the knee shate. No da sirf staphenofemoral junction ke ka problem hi hagala para surgery ba amda se ka stephenopopliteal junction po level ke problem hi amda ka se cut ba lagau, lekin دغه به پوزیشن چې هغه به ډیفرنٹ دی. فار ایگزامپل هغه به په پلیټل لیول باندې، او بل کټ به چې لګیږي، بل انسیژن به چې لګیږي هغه به انکل لیول باندې لګیږي، او نور به چې دا پروسیجر سیم وي. جنرال انستیزیا اوله به بیا هغه نه بعد به کلیپینګ اف د وینز کوي، هغه به نیرو کوي، بیا هغه نه بعد به کټ لګوي، بیا هغه نه بعد به وایر پاس کوي، او آخري کې چې دا سټاکینګ به استعمالوي. سټاکینګ استعمالوي، ما تاسو ته ویلي چې د سټاکینګ فنکشن دا ده چې دا ډایلیټډ وینز چې دا نور هم اضافي یا مزید ډایلیټډ وینز ونسي، او بل چې دا هغه ریکوري لپاره هم ښه ده، چې مزید ریکوري هغه لپاره هم دا ښه راځي. نو اوس دلته راځو، نو اوس به تاسو زیات ښه په دې باندې پوه شئ. سټیجز اف د varicose vein، هغه موږ چې کلاسیفیکیشن شاته ویلي وو، the classification that we have gone through in the last slide, in the previous slide, I think it was a clinical classification, so when I will share the slides you will come to know, okay, about my points. The classifications, I said that it's like initially it doesn't visible C0, if you remember, okay, and it's one level, it was a kind of threaded veins, a reticular veins, like having a diameter of 1 to 3 millimeter. So here, look, it's just not that visible. Okay, it's so visible but not that extent, like you need to put a concentration on that. Okay, uh, it's a reticular veins. Okay, and it's also or a spider veins, because it's just like propagating the city like the spider jal nadi, spider jal on the spider way. And the one picture ke gore, on a second picture it's a varicose vein gora properly kare. Delta catasugure, delta tasugure, varicose vein parsideli, veins در تخیم ابخا در تنخیم اوس فی الحال منگا د veins باندې concentrate کو veins parsideli دي دلته veins چې دا ګوره تار غوندې ښکاري او دلته چې دا veins parsideli دي. The veins are dilated here, the veins are a thread like. Okay, so here is the edema, you know, like swelling of the lower leg. Now compare, where is the row? Yeah. Now compare this leg with this leg. Look. So this is called edema of the lower leg. Okay. And then like these are all stages. First stage is a less severe, and then more like mild, moderate, and then severe. Now look at this stage. Okay. There is there is varicose vein. You can see that this one, these are the varicose women. And then eczema means skins become rough, skin become dry. Okay, now where is, okay, now now compare this skin and with this skin, it just shines, it's smooth. Okay, the upper part, but this one is not, it just seems to be so rough, dry. And the trophic ulcer, I tell you, it this side, not this time, this is a normal. Okay, but sometimes, you know, this one, if you know, like look, this one, look, color changes occur, so it just like becomes the white ulcerated area, pigmented area. Look, and trophic ulcer, look at this side, it just a color like changes, like from the upside it's a bright one, lower side it's a dark one. Okay, so next, yeah, that was today's lecture. It was a short one, and now I take your questions. So yeah, please, if you have got any question, you may ask me, please. And I hope that I am able enough like to make you understand about this topic. I have been like keep speaking in Pashto because I don't know actually Dari, but yeah, of course for a Dari speaking people person, I just like try to like make you understand in the English language. Okay, Najma, yes, Najma sister, what's your question, please?
Assalamu alaikum, ma'am.
Walaikum salam.
First of all, thank you so much for the giving this amazing lecture. My question is that ma'am, pregnant can be one risk factor for the varicose cell. If there, yes, how management for the pregnant woman? Which therapy you can use for the pregnant woman when they're addicted to the varicose veins?
Okay. What else? But this was the only question.
Yes, other one is also, I have that. I answered that. I asked.
Oh, yeah, you say that the pregnant woman can have varicose vein. You asked that question, right?
Yes.
Actually, in pregnancy, you know that there is a chances of the varicose vein, but of course, in pregnancy, there are a lot of other things happening too. Okay, so obesity is different from the pregnancy, if you come to know. For example, in pregnancy, the size of the uterus become enlarged. There is also like tiredness, like all the symptoms that I must say of the varicose vein do exist in a pregnant woman. But if you do consider after the delivery, like the regression of the uterus size occur, and of course the other symptoms like body comes to the normal size. So normal position and normal size. So pregnancy is not that obesity or actual obesity. So I personally I don't do consider about that pregnancy does cause varicose vein. But of course, if there is a pregnancy, I like explained earlier, like if it's asymptomatic in a pregnancy, you need to do consider all the conditions that she is a pregnant or normal lady. If she's a pregnant, you need to consider this the size of the female is enlarged because of her internal changes, her pregnant changes. Okay, so it's not a normal obesity. We need to like keep her in a normal lifestyle. Like we have to say that you need to bring the lifestyle changes. For example, like she need to take a fiber diet, she need to like continue the walk. For there is a like a stigma exists in our people that in pregnancy women shouldn't like move, women shouldn't like doing physical stuff and everything. But it's a wrong concept. I do consider that she needs to do some moderate exercises like walking. She need to keep the cholesterol level low, like by taking the fiber diets, like normal diet. Avoid the sugary, like sugary, what should I say, mashrubat, drinks, sugary drinks, like she should avoid that. It's like normal. Like these are the lifestyle modifications that we need to prescribe for a pregnant lady. And if the situation gets worse, like she has developed varicose vein despite like pregnancy, then we need to take it serious. We need to go through all the procedures, all the things like I have explained earlier. For example, like that laser ablation, everything. And in the worst situation, of course, we will go through the surgery as well. You got like, first we need to consider the pregnancy, and then we need to like prescribe her these diet changes. But if still there is a varicose vein, we need to take it like other patients.
Okay, okay, I got it, ma'am. And I have other question also. I asked it,
Yes, please. What?
ma'am.
Sorry, I didn't get you.
Yes, ma'am. Before you mentioned that if there problem in the perforator vein, and that the varicose vein is occur, but in the part of surgery, you see we can remove the superficial. When we there problem in perforator vein, which time why we are not removing the perforator vein, and instead of that we need the removing superficial vein?
No, actually, I have sorry if I didn't like mention. I apologize for that. But I have the video was only for the problem if a problem occur in the superficial vein and saphenofemoral junction or saphenopopliteal junction. That video was only for both these two junctions, like superficial veins. But if you have a perforator veins, there is a problem in the perforator veins. We need to go to the phlebectomy. Did I explain it to you or not? I think I didn't, maybe. But in phlebectomy, what does happen that we need to do the surgery of the perforator veins if there is a problem in the perforator veins. Like we need to ligate it, we need to cut it, we need to remove it, and that is for the perforator veins. Let me look. The videos were the first, these two, like saphenofemoral lesion, perforator veins. It's another things. We don't need to like pass that thread. Sorry, that fiber, I forgot the name. But of course, in the perforator, we need to the surgery separately. Okay, it doesn't like relate to that superficial veins. So here, I need to tell you one thing more, that there are small veins with a superficial vein as well. For that, if you remember the video, the last part of the video, he is like giving a third incision as well. That third incision was for the small veins. These veins were accompanying the superficial veins. So we need to remove that small vein as well. And the reason behind was that, like, they can because they can become a recur, the chance of there might be a recurrence, chances of recurrence of the disease. So we need to phlebectomy for that small veins and also for the perforator veins. Like it's a different, and then we need to do the surgery that I have shown a video, and that video is only for the problem if there is a problem in the superficial ones.
Okay, thank you, ma'am. Good.
No problem. Any question, please? Yeah, please. I don't know how to operate this stuff. If anyone got a question, you just unmute yourself and may ask.
Hello everyone. Thank you so much, respected Dr. Diva, for such brilliant lecture. My question was this: that kidney disorder, is there any relationship between kidney disorder and varicose vein? I mean that any kidney disorder can lead to varicose vein or no?
Well, what is the function? I don't have that, extensive knowledge about that. Okay. You said it's kidney, right? Right? It was kidney. Kidney, right? What are you
Yes,
talking? Okay.
yes, kidney disorder, any kidney disorder.
Well, I don't have, sorry, apologize. I don't have that much information, but what I do think that the function of the kidney is remove the extra, fluid from the body. So, and what is the varicose vein? Varicose vein mean like, it's just like when the flow of the, blood, it's like in a downward direction, it's in opposite directions. If there is a mass present, if there is a, pressure is present, if is kidney like is disturbing to the body to that extent, like if there is accumulation of the fluid around the veins in the leg. You got my point? What has happened that when
Yes,
kidneys are not functioning, the function of the kidney is to remove the extra fluid from the body, okay, in a form of urine. So when kidney is unable to remove the fluid, the fluids accumulate into the leg. So when it accumulates, it might, if it get like accumulates to that level, to that extent, that it just get surrounded by the veins of the leg, for example, like in legs, so and they starting putting pressure, anything that putting pressure on the superficial vein, then it might get, but it's just my own concept. If you can, I will share my email. I will search about that. I will, like go through it. I can give you a very proper, answer about that. But what I personally think that if kidney disease is very severe, to this where that fluid accumulates and it just like surround the veins, and then it like pressurize the vein like any other mass, then definitely it can cause the varicose vein. But I need to, consult it. Like telling you, so you might contact me, and I'm going to give you my email ID for that, and I'm going to consult it, because I think it's good to consult before like propagating any information.
thank you so much for your good information, teacher. Thank you so much.
No problem. Any other, please? Hello, am I audible?
Hello, hear me? Yes.
Yeah, I do hear. Yes, please.
Thanks so much, Dr. Diva. It was a good lecture, and I like to have you lecture much. It is the one risk factor of the varicose vein or not, or when we get older and our vein are dilated, is the risk factor of varicose vein or not? Thank you.
Okay, so your question was that when we get older, like age can have effect on the varicose vein or not. Actually, what should I say about that? All the causes that I have described above, there was not mentioned about age. What happens in the age, laxivity occur. Like you can say that our skin or anything like our veins, arteries, either these loses its flexibility. So I'm not sure about that. if it was age, I would definitely uh, I would definitely in medical terms, if age is any problem or age is anything, but they would mention it. But whenever it comes to my mind, when I was like working in a hospital in last year, and I have gone through this varicose vein, they all the male patients, male patients, they were aged, but it doesn't seem age has not that correlated with that. But of course, if it comes to the female, that in female specifically, when age is increasing, weight gets increased automatically. You know that now, because post menopause occur, estrogen level is not that good, and of course hormonal level is disturbed, and it's just like normal that in female with increased age, a person gets fatter, a person get obese. So obesity is the cause, is the reason of this varicose vein. But you're talking about the specific age, so I don't think so that age might be the reason of this. But of course, I need to confirm it as well, but this is my personal perception. In a female with increased age, they get like weight, and whenever they get obese, so they may suffer from varicose vein. So yeah, I have explained everything in this slide. These are the main causes. I got these slides from the Bele and Love, and another book is Dogar. Okay, I have like gone through these main books. These are the main books of the course that are usually being taught in the student Pakistan final year MBBS. So there was no age factor. Usually whenever there is an age factor, they mention on the top. So if there was an age factor, they would mention it. I hope you got my answer. But of course, you personal, I can say it's not good, but I can personally say that you can go through the Google. So I again would reply, if there was a age reason, if there was a reason behind like age, they would mention it like any other disease.
Okay, thank you. Got it.
Yes, please. Any other question? I will be sharing my email ID with you all, and inshallah, any other some people are reluctant to talk on a mic. I was a kind of student like this too. So there was a question about the kidney, if a person is suffering from kidney disease, so he might be having a varicose vein or not. And then I need to answer another question, that age is a factor. I have to I tried to explain with my point of view, but still I need to consult a book and my senior for that. And inshallah, I will be helping you in this regard, and I will providing the information with whatever I can. So if you people got any other question, you may please unmute your mic and you may ask. او بیا زه ټولو نه بخښنه غواړم چې زه شاید ما ډېر زیات سپیډ کې خبرې کړي، یا ما صحیح درس هغه طریقې سره تاسو ته کنوې کړی نه، نو بیا هم زه دې نه معذرت غواړم. نو ما کوشش وکړه انشاءالله، او فیوچر کې به نور هم انشاءالله موږ کمیونیکیټ کوو او ښه طریقې سره به دا شی مخکې بوځو. Yes, please, Mursal, you can unmute your mic.
Hello, Dr. Deva. I hope
Hello.
you will be fine. I have a question, but it's outside of the lecture. Are you resident of medical surgery, resident of surgery in Pakistan?
Uh, no, actually, I am applying for the residency in abroad, not in Pakistan. I'm just graduated. Inshallah, I will be leaving abroad for my residency soon, inshallah.
I asked this question because, as you know, in Afghanistan, the residency program is banned for females. I just want to ask if is there the environment is favorable for female who can be come to Pakistan or for
Well,
residency?
you're my sister. This question, I would just say that there are multiple, sites or people or NGOs that are helping out, Afghan girls specifically to, for their residency, or you can say this is called post graduation. So in residency in Pakistan, it's a quite competitive. I have like gone through all my, like I have completed all my studies here in Pakistan from 12th, like from first class to 12th class, and then 5 year medical MBBS. But the thing is that the working hours or routine is quite tough for the male and females both here. And secondly, the pays are not that good comparatively other like countries. Okay, like you need to give a 30 hours consecutive duty. For example, you come today at 8 a.m. and then you would have to leave tomorrow 2 p.m. You need to like spend night in hospital too. This is called call. So it just depends. Every call is different. Like it depends on the department you choose. Like if you go to the surgery or medicine, derma, orthopedic, everything. And gynae is the most hectic one. We as a girl always go for the gynecology and obstetrics, but it is the most hectic one. So I'm trying. I just like personally suggest you to go for plab. You know that plab.
Yeah,
You
yeah.
all you all are mashallah wonderful when it
Okay.
comes. Yeah, when it comes to talk in this English language. If you are, I think you are all in final year. So just like start
Yes,
prepare.
I'm a postgraduate.
Yeah, you
With
start
my
preparing yourself for the OET exam, English language exam. English language exam are two types, OET and IELTS. I would suggest that don't go for the IELTS. IELTS is a quite like kind of tough because there is a a lot of conditions to pass the IELTS. So you just need to appear in this OET exam. OET exam is very easy to pass. It's this facility is only available for the girls. So pass the OET exam, start the preparing for the OET exam. There are multiple online websites that teach OET exam online. You need to pay online and then learn it. And pass that exam, appear in the plab exam. You can appear in the plab exam in Pakistan as well. I do live in Islamabad. So come here in Islamabad, Lahore, Karachi, where you want to appear in the test, clear your Plan 1 exam, and then go for to the United Kingdom for Plan 2 exam. I think that would be a very good options. And just like try to like find means, like search a means to there are multiple. I told you already NGOs that are helping girls. So try to approach the NGOs and told them that you are not having any kind of opportunity. Uh, maybe maybe they skip OET exam or IELTS exam for you. You just need to appear in the PLAB 1 and then directly PLAB 2. So everything can be happen. The situation is kind of this, so they are helping out. Just you need to communicate with the people. You need to communicate with the NGOs, and you need to present your case. You need to present your problems that we want to study. So
Okay, if you share your email address, I will send you some email and ask for some suggestion because I doesn't have any information about